I think that's not a problem. Oh, sorry, that the robot voice came in. That's not a problem for me.
Mhm.
So I think that we can go through the presentation and then if you want to stay on after, we can stop recording and you can ask your questions. And I think we can answer them to the best of our ability, right, Crystal?
Mhm.
Okay, guys, I'm going to get started. So, we're here to talk today about earned sick and safe time. Um, so sick and safe time is paid leave that employers must provide to employees in Minnesota, and it can be used for specific and legally defined reasons. That is, if an employee is sick, and if an employee is caring for a sick family member, or to seek assistance if the employee or their family member has experienced domestic abuse, sexual assault, or stalking. Under the law, all employers must provide their employees with a minimum of 1 hour of paid time off work with no consequences for every 30 hours worked. So how did we get this? The union fought hard for years alongside partner organizations and legislators to pass this law. Governor Walz signed it into law, and it went into effect on January 1st of 2024. So there will be some changes this coming year. So now we'll talk about that because I bet you guys have had some questions about this at your work sites. So beginning on January 1st, so it's actually already happened, they will no longer be able to track sick and safe leave separate from accrued PTO or sick hours. So instead, all PTO or sick hours accrued since 1/1 of 2024 will be covered under the law. So, if you used your accrued sick time or PTO to recover from an illness, to care for a sick family member, or because of domestic violence, sexual assault, or stalking, that absence cannot count against you for an attendance under the employer's attendance policy. So I think we have a very strong Fairview meeting tonight. So I think they call those points or occurrences, and it won't be that. So for employees who work less than a benefit eligible position, they will continue to accrue the 1 hour of sick and safe time for each 30 hours worked, up to 48 per year. So for the folks that are less than a benefit eligible position, nothing is changing. For those of you guys that are benefit eligible, you're going to have a lot more access to safe and sick time. Because you used to be limited to that 48 hours a year that you could accrue, and now it will be your entire sick or PTO bank. Um, I will say, in order to qualify for protection from occurrences under the law, you need to report a sick and safe time covered reason for being absent. So calling in and saying I'm sick instead of saying I can't come in. What can it be used for? So your own personal illness or treatment or preventative care, domestic violence, care for a sick family member that also includes treatment or preventative care, an absence due to domestic abuse, sexual assault, or stalking of the employee or a family member. Also, a workplace closure or the closure of a workplace or a school of a family member due to a public emergency. And a healthcare agency or professional determining that you or a family member is at risk of infecting others with a communicable disease. This is a lot, so I do know that we'll be uploading stuff onto the website, so you guys will be able to go through it. But as you can see, the way that family was defined in the law is very robust. So, who is covered? It's a child, including a foster child, an adult child, a legal ward, or a child for whom the employee is a guardian. Spouses or a registered domestic partner. Siblings, step siblings, or foster siblings, biological, adoptive, or foster parents, grandchildren, step grandchildren, or foster grandchildren, grandparents or step grandparents, nieces, nephews, aunts, and uncles, children or sibling in law, a child or a sibling in laws, and any family member listed above of an employee's spouse or registered domestic partner. I know that quite often, as you guys know, people might be the person who cares for their like let's say their husband's mother when she's sick. So that the law was designed to encompass that. And then any other individual related by blood or whose close association with the employee is equivalent to family, and one other individual to be designated annually by an employee. What about documentation? I do know that I think a lot of people will be excited about this. So an employer can require an employee to provide reasonable documentation of ESST use only when more than 3 consecutive scheduled workdays of ESST are used. If the employee is unable to secure the requested documentation, in most cases, the employee may supply the employer with a written statement indicating that the employee is using or used ESST for a qualified purpose. The written statement may be written in the employee's first language and does not need to be notarized or in any particular format. That means that you can provide your own note for using ESST for more than 3 consecutive days. How will or may employers react to this? We actually anticipated that they would change their policies to comply with the law effective January 1st. And we will let you know if we receive any information about that change. Actually, you guys, just because people here are Fairview heavy, what we received from Fairview wasn't really a lot of change. I don't think necessarily that their policy acknowledges the change, so it's important that people know it so we can be on the lookout for this in any attendance meetings. Because they are definitely not advertising it to you guys. So we've got more union wins coming. So in 2026, all Minnesotans will be eligible to take off up to 20 weeks with pay to care for themselves or their families when sick, injured, or taking care of a new baby.
Ooh.
So it's going to go through the state just like unemployment insurance. So you will be able to go out. This was a very big win. I think a lot of us are very excited about this. If you've worked at a hospital for any period of time, you've seen somebody come in and find out maybe they were pregnant or a loved one became ill when they started a new job and they had to be told they didn't qualify for FMLA because they hadn't been there for long enough. That won't be the case with this law because it will be based on their amount of employment in the state.
Mm.
So how do we win all this? We did this through political action. So we have a political committee that does political work. We also do a lobby day where our members show up. We might have various events at the Capitol throughout the year in support of specific legislation. But really and truthfully, one of the biggest ways we do this is by people contributing to COPE. I know when you guys have new people in the hospital, they say, what is COPE? It's very important because it's how we're able to win things sometimes through the legislature that employers would be incredibly reticent to give to you guys in a contract. And we are able to use COPE to hold politicians accountable to what's important to all of us at our work sites. And these can have a big impact on our job. So I'm going to show you guys the COPE QR code. These will probably be, I think everybody's going to be doing tabling on this at your facilities too. This will probably be at all of your facilities. Okay, so I was going to put you guys into a breakout room, but we have a really small group. So I can put you guys into a breakout room, or we could do it in here, or I can send folks into there. But I was gonna have you guys role play where one person will pretend that they're one of your coworkers and they did not just hear all of this about ESST, and the other person would pretend to be telling them about ESST. And then they could switch places, and I was gonna give you guys about 10 minutes to do that. I think we can still do it. That I guess I might have to put Crystal into a room. Okay, well then we'll still do it. And then we'll come back and I've got some more links for you guys here so that you guys have some access to some more resources. So I'll go ahead and assign you guys into the breakout rooms. I was gonna give you guys 10 minutes to do this. So let me see.
And after you're done assigning us to breakout rooms, or maybe before, I think you could stop the recording because we don't need our role plays recorded.
Oh yeah, huh?
But I know as a host, you've got a lot of things to deal with there, so I'll take your
Just give
time.
me a second.
Yeah, take your time.
I have actually, Crystal, I have never recorded a meeting.
I've only done it a few times. It said it was going to upload it to the cloud, so the question is going to be how to get it afterwards. But I think it'll give you some instructions. Hopefully,
Let me see if this stops it.
maybe it'll save on mine. I don't know. We'll see.